cognitive behavioural therapy. What is it all about? Let's check it out. What CBT can look after and help with the following problems, such as substance abuse disorder, schizophrenia, and other psychotic disorders, even depression, bipolar disorders, somatoform disorders, insomnia, anger, aggression, stress, general mental health conditions, fatigue. It is wonderful. Why? Well, according to the research, cognitive behavioural therapy, or CBT, is a type of psychotherapeutic treatment that helps all of the aforementioned illnesses and conditions. It helps individuals understand that thoughts that they have and the feelings that they have are influential towards them and others around them. Within cognitive behavioural therapy, there is a structure, and a time-limited structure at that. It's goal-orientated, so that there's a form of therapy that focuses on the interplay between a person's thoughts, their emotions, and their behaviours. Now, the underlying principle of CBT is that our thoughts, which are our cognitions, signify and push and create and make a crevice towards that significance of our feelings, and therefore, in turn, our behaviours. Now, that's all very well and good, but the reality and the bottom line question is, does CBT work? Well, CBT is typically short term, which involves anywhere from a few weeks to a few months. Now, this depends on your or the individual's needs and the nature of their issues. I mentioned a whole plethora of them before that, but think about this. CBT versus long-term therapy, which can be years. That means ching ching, a lot of money. So if you can go short-term at something and it relieves a long-term ailment, why not? CBT involves assessment, right? What goes on in the assessment with the particular therapist? Well, there's a discussion here of the particular issue. One issue is broken down and personalized towards the individual. So if the individual doesn't have a clue whatsoever what the issue is, but says, I'm nervous, for example, and then goes into symptoms, straight away the therapist will be able to link that with the common outcomes or longevity, or perhaps the issues that are around that particular complaint. So this is what happens at the beginning. Then the client is facing, say, a specific set of achievable goals from the therapist. So the therapist can outline what can go on. Here's what is possible. Here's how we can improve it. Here's how long it may take. Now, everybody is different. So if you're looking at it right now in just a video right now, remember, I can't see you. You're not in front of me. So therefore, we're not diagnosing anything. So you may need to go to an individual therapist or indeed a medical doctor for diagnosis. Then you need to identify the negative thoughts. This is what the therapist will help you do. They're trying to eke out what is going on up here. What is going on up here essentially dictates what goes on out there for ourselves over time. Now, the therapist helps you or the client to identify negative or distorted thought patterns that contribute to eventually the behavior via the feelings that you have. If we resonate, which a lot of belief is out there, our energy and our rhythm to the world, therefore people will treat us with regard to what is up here. And that means what is up here in our minds goes out towards our behavior. So identifying these negative thought patterns is clinical. Now, why is it so important, negative versus positive? Because positive can be a range of things. That's where creativity comes from. That's where innovation comes from. That's where, okay, if you just want to go through the old dum routine of everyday life, that's okay too. That necessarily doesn't have to be negative. It can be very good if you just want to be a person who skates along the line and is happy to go through life in a humdrum manner. That's absolutely fine. But negative thoughts are ones that are self-destructive. You're creating the thoughts rather than something objectively happening to you outside in the world that's giving you a trauma. So it's just you are using the creativity that you have, the innovation that you have, in a negative fashion towards yourself. So you're pushing yourself back and down. The therapist then for CBT will also challenge your negative thoughts. They'll say, well, is that a real thought? Why does this have to happen in the future? Now, you might have an anxiety thrown in with this. It's glued together perhaps with a negative thought or thoughts or series of thoughts. And there may be a genuine reason for this because you have had a past trauma. Now, that trauma may never actually have affected you. However, it's really important for the therapist to know exactly what happened to you in the most amount of ways, and to get to know you and to build that rapport in the first place, so that they know what personality you are beyond what's going on with regard to your ailment in the first place that you're coming to them. So it's really important that they challenge the negative thoughts and they identify what is negative and what is positive. You can give particulars about thoughts and behaviors and actions, and that's great, but you have to let go. Let the therapist, who is very finely trained to be able to address what it is you are and what it is the normal route towards getting towards the positive thought pattern. The therapist teaches the client then how to challenge and reframe these negative thoughts into more realistic and positive ones. Now, when I say reframe them, the thoughts might be so strong that they're very difficult to go away. So what you need to do then is make sure you can put a different frame, such as like a picture frame. If it's a circle, you can go wider, for example, with a rectangle and encompass that circle. So there might be negative on one side of the outcome if you choose to go down that route. If you're, for example, you are anxious towards a future event, going off a particular experience from the past that was negative, so therefore you go, that could happen, rather than that will happen. By reframing it, you're saying that's not the option I'm going to take, because I'm going to take the road that's over here, which is also in the bigger rectangular frame, and not the circle of what was negative in the last part of your life. Then they also look at your behavioral activation. They're encouraging you to engage in this behavior that's new, that's positive, rather than in the known negative behaviors you've done in the past. The reason for this is so that you can improve your mood and reduce avoidance behaviors, because we as human beings, we're kind of silly in lots of ways, insofar as even though we know what the right thing to do is, and we can read about it and watch videos like this, we still go out, and I certainly do, and do the wrong things again and again and again. And then we look back and we go, well, this is the reason I'm here in the first place. So we need to be able to clear the deck and open ourselves up, let the CBT therapist in, to be able to go and be constructive with their criticism, to get you forward to a more positive mindset and more positive behavior in the future. There's also, through that therapist, skills building going on. So the therapist teaches the client or you coping skills and techniques to manage stress, because when we have problematic thought, it's going to create problems throughout our body. So when we think, other things like a cycle sync and transfer through a pathway of our nervous system toward our body. Now, okay, there mightn't be an outcome in our body straight away, but it's stored in there somewhere within that shape of your body from head to tip to toe. So it's important that we build our skills to go against that and previous negative thoughts, so that we're building more potential behaviors, and let's call them outbursts that are positive, that you actually go, wow, this is wonderful, I did this. Maybe it might be a very personal thing, I'm sure it will be, because of your negative behaviors or thoughts. Most of them are in our heads and don't come out, but they destruct us within our bodies going forward. So if we can be positive and have positive thoughts and feelings towards ourselves and thoughts towards ourselves, we mightn't actually throw it out there from the surface towards others. It might be not actually realistic towards what we achieve in life, but if we feel it within ourselves, that's where our body within ourselves feels good because of it. Then the behavioral therapist will give homework to the client. Now, the homework is so important because clients need to do assignments to essentially code our thinking patterns. We have patterns, not just one thought that's negative. Our thinking can become distorted and negative over time. And that's the way our brain works. It likes to connect one thought to the next thought. And that's a series of thoughts, and suddenly it becomes, whoa, he's a negative guy. Don't want to be around him, bad energy. But if you do the homework that connects one good thought, one positive thought, and then another one, suddenly there's a whole avalanche of positive feeling and your energy changes. Another thing that the therapist will do then is review and adjust. They can see things early on. They have the training. They have the templates and the case studies. You might fit easily into one of those. However, you might not, because I said before, you might, and surely are, an individual. Therefore, your individual experiences and how you perceive them are not the same as each person on their case studies that they've done in many, many hundreds of hours of training. And so therefore, by adjusting and reviewing and checking you out throughout your journey of recovery, you're essentially being treated like a prince or princess, and that's the way you should be treated. I hope you feel you've been treated like that in this particular video, and that you got something from it. If you have, well, thank you for watching. Please do watch more.